Within this section, we're going to talk about replacing the microbiome of the colon via fecal microbiota transplantation. The last in the treatments for multiply recurrent C. difficile, but potentially one of the most efficacious, if not the most efficacious, of all of the therapies. And I'd like to discuss 3 landmark studies that really put fecal microbiota transplantation on the map. The first is a study that was published in the New England Journal of Medicine back in January of 2013. It was the first prospective randomized controlled trial comparing fecal microbiota transplantation versus vancomycin versus also vancomycin and a bowel lavage. Within this study, the fecal transplants were performed via a nasoenteric transplant. The study was actually stopped at the interim analysis because the efficacy of fecal transplant was so much better than the efficacy of vancomycin alone and vancomycin with bowel lavage. Specifically, those that received a nasoenteric fecal transplant responded in a very, very high clip. 13 out of 16 patients responded. That was compared with 23.1 versus 30.8% response rates with the vancomycin and vancomycin with bowel lavage. So we can see that a fecal transplant seems to be a very effective therapy. Interestingly enough, within this study, they also characterized the microbiota of the donor pre-transplant, of the recipient pre-transplant, and then the recipient post-transplant, further supporting the efficacy of a fecal microbiota transplantation, supplanting and supplementing the microbiome in a diseased patient and improving the complement of the colonization resistance. In addition, during this study, of the 3 patients that did not initially respond to the fecal microbiota transplant, they all received fecal transplant again, and 2 of those 3 patients successfully were cured from C. difficile. The second study was the first meta-analysis put forward by Zane Kassem. It was put forward in April of 2013 in the American Journal of Gastroenterology, looked at 11 studies and 273 patients. The concepts from this initial meta-analysis are still supported today. Specifically, that the efficacy of fecal microbiota transplantation in a population of patients with multiply recurrent C. difficile is about 89%. There seems to be higher efficacy with lower administration, defined by an enema, a flexible sigmoidoscopic examination, or colonoscopic application of the stool, compared with an upper administration via capsules or nasoenteric. The response rates to a lower administration were 91.2% versus 80% with the upper administration. And there was no difference between those who received a fecal transplant donated from a friend or relative versus a complete stranger. And the third of the landmark studies was a study by Youngster et al., where they simply said, why don't we take stool, put it in a capsule, and give it to these patients with multiply recurrent C. difficile? And that's what they did. They gave 15 capsules on 2 consecutive days to 20 patients with multiply recurrent C. difficile, and overall 14 of the 20 responded initially. Of the 6 that didn't respond initially, 4 of the 6 responded to a second application, once again showing the efficacy of fecal microbiota transplantation in the treatment of multiply recurrent C. difficile infection. So this is a treatment that has gained a lot of traction over recent years and is more widely adopted, having gained adoption within the American Journal of Gastroenterology guidelines in 2013, and then even more so in the Infectious Disease Society of America guidelines published in 2018, where it was recommended that this application be given and this treatment be given after 3 antimicrobial courses. Many practitioners are using this even earlier in the treatment algorithm, but we are still awaiting a pharmaceutically produced product that has phase 3 data. Until that time, it certainly is up for debate whether this should be used earlier. But it seems to be that patients respond very well to this treatment, and it seems also very, very safe.